little bit of Grover in the background, it's time to bring on one of the best, one of the greatest of all times when it comes to dentistry. And her name is Karan Wade. She is a doctor of dentistry, and it is her time here on 1230. Good morning to you, Dr. Wade.
Good morning, good morning, good morning.
Good morning, good morning,
I'm so happy to be here.
Oh, yeah. Hopefully you had a great day.
Oh, I'm going to have a great day.
Okay.
I insist upon it.
Well, then do it. Hey, you're Karan Wade. That is a Karan Wade day.
Well, if you speak it into existence, I believe it'll happen. So I'm not going to speak negativity into my life or into my world or into my space. So I'm going to speak everything that's positive. So I say that I'm going to have a good day.
Well, let's have a good day talking dentistry today. What is on the agenda for today, Dr. Wade?
On the agenda for today, I wanted to talk about persons or people who have diabetes and their dental health. Because, well, first thing before I start that, I want to thank all of your listeners that have called in and have come by to see me. I really, really appreciate that. And I just wanted to just tell all of them that I really thank them and I really appreciate them. And I would hope that they would continue to come see me, and I hope that I took care of their needs. And the ones who haven't come to see me, I invite you to come on down. The office number is 713-654-7756. Again, the office number is 713-654-7756. But what I wanted to talk about today were persons who have diabetes, and people who have diabetes, they know that diabetes can be harmful to their eyes, their nerves, kidneys, heart, and other major organs in their body. But a lot of them don't know, or if they do know, a lot of them don't put a great emphasis on it, that people with diabetes are at special risk of developing periodontal disease, which is a gum disease. And what happens when you have periodontal disease, the bacteria that's in your mouth gets down into the bone and your gums, and it destroys the bone that actually hold your teeth in your mouth, and it causes inflammation, bleeding of the gums, and you can actually lose your teeth. Okay, it can also cause you can have pain when you're chewing. You have difficulty when you're with dry mouth because patients who have diabetes, they tend to have problems with dry mouth, and when you have dry mouth, that would increase your risk of getting decay or cavities in your teeth. When your blood glucose is not controlled, that also plays a significant part in problems with having problems with your mouth, because when you have a high blood glucose or blood sugar, it causes bacteria to breed more or increase the blood bacteria count in your mouth. We all have bacteria in our mouth, but when you have something in your mouth that bacteria can thrive off of or eat off of or causes them to grow more, you want to decrease that. So you should seek regular dental health checkups from your dentist. The other thing that I wanted to just kind of give some patients who have diabetes are what we call them, some little dental healthy tips. The first thing, you should see your dentist every 6 months and make sure you have your teeth cleaned at least every 6 months. If you see any areas of concern that might be redness or a swelling in your gums, you might want to see your dentist as soon as possible, because that's an indication of inflammation or some type of infection in your teeth. Okay. You can get any of this information. You can go online or you can call my office, and I would gladly send this information to you. I just wanted to just kind of like give that information out to our patients out there who have diabetes or are suffering from diabetes, or who might know someone who has diabetes, because diabetes is a very serious health condition, and a lot of people don't. They think the only thing they need to do is check their blood sugar or their blood glucose, and that's it. But diabetes can be something that can be very detrimental to your health, especially your oral health. So if you have any questions about diabetes and your oral health, or any kind of dental questions, feel free to give us a call. And Michael's going to give you the number to the station, because I never remember the number.
Well, the number is 713-526-1230, 713-526-1230. If you have any questions for Dr. Wade concerning your dental health, please feel free to call. They were talking about your economic health earlier, and now we want to talk about your physical health, and that involves what is it, mouth, teeth, and gums?
Yes, your mouth, your teeth, and gums. That's exactly right. But you can have other problems that can stem from your mouth, your teeth, and your gums. If you don't take care of those pearly whites, they will go away.
And speaking of diabetes, as we prepare to take a phone call, what I want you to think about is, are there different types of problems related to the different types of diabetes as well. But right now we have a call.
Good morning.
Okay, let me push this button first. There you go.
Good morning.
Peace. I'd like to give a personal testimony if that's possible.
Sure, go ahead.
Yes, my name is Elevation Allah. I'm actually a patient of Dr. Karan Wade. I just want to let everybody know how much of a professional she is, how transparent she is when it comes to doing business. You know, she takes accountability for her actions. She's ownership. Look, and she's the only dentist I've ever been to that doesn't give me a lot of pain. So, you might think I work for her. I don't work for her. I'm just a patient. But, once again, you know, she's a great dentist. I advise everybody to go down and see her. That's all I wanted to say.
Okay, well, I'd like to tell you thank you for that little plug there. I really appreciate it. It's my pleasure in taking care of you, and I know exactly who you are.
Yes, ma'am.
And I appreciate you calling in and you know, just letting the listeners know that there's really no need for people to be afraid to go to a dentist. I know you might have had some bad experiences or heard stories about going to the dentist, horror stories about going to the dentist, but, you know, going to the dentist can be a very pleasant experience. But if you wait till things get to the point where you're in pain when you get there, well, you can't expect for the dentist not to cause you any kind of pain when you were in pain when you first got there. So we try to do our best to make sure that the patients are alleviated of any pain, but there's no reason to be afraid to go to the dentist nowadays, not in 2015. And I appreciate you calling.
On top of that, Dr. Wade, I will say that I believe, my theory is some of these dentists out here, they do something to their lidocaine or to their anesthesia so that it's not as powerful.
Mm-hmm.
But when you use it, hey, I feel it. I don't feel the needle going in, but I feel the impact from the anesthesia.
Right. Well, there are different strengths of anesthesia that dentists use, and some dentists might use something that doesn't have as much anesthesia in it. But I use the strongest anesthesia that's on the market because I know patients always have that fear of going to the dentist, and sometimes some patients are a little bit more difficult to get numb than others. So I tend to use the strongest anesthesia when they come in, so we won't even have that problem.
Yes, ma'am.
All right. Thank you so much for calling in.
Thank you, Dr. Wade.
All right. Bye-bye.
713-526-1230. That is the number, 713-526-1230. Dr. Karan Wade is in the house answering your questions. Now, is there a difference between, because I know they talk about type 2, type 1.
There are different types of diabetes, yes, but the different types of diabetes, it doesn't cause any different problems in your mouth. A diabetes is going to cause the same problems that you have, whether you have type 1 or type 2 diabetes. One type of diabetes is one that children can get. It's like what they call early onset or diabetes, and it's usually starts probably like in early, sometimes it can start in early adolescence. Sometimes they can diagnose them a little bit earlier than that. It just... It's just
I'm looking at the purse. That's a lovely purse.
Well, thank you,
it
Mike.
It looks like...
no, it's not.
Well, I didn't.
Whoever you think it is not.
No, what it looks like is when I was in college, many, many moons ago, some 40-something years ago, my to-be wife bought me a jacket, a sweater that was made out of, had an ultra suede front to it that looked so much like that. It was the same color. The only difference was it just had a little, I guess you could say, a little texture to the and
so my color of my purse reminded you of that.
And the way and the leather and stuff on it. I have a picture of me wearing that sweater.
Okay,
by the way,
you gotta let me see that picture, Mike.
Okay, so you don't think. And that's what I was just looking at, because it is a lovely purse on its own. But it's amazing how things can stimulate.
Oh yeah. You can look at one thing and it can help cause you to reflect back on something that you hadn't thought about in years. Even smells do that. You can remember how it used to smell when you were a child, and go into your grandmother's house and she's baking a pie or cake or something like that. And if you have that same smell now, it's the olfactory sensory organ will cause you to remember, that feeling that you got when you were a young child.
And music certainly does it. But we digress.
we got off track, though. You got off track with the color of the purse. But as far as the diabetes and early onset, the early onset diabetes can happen when, young children. Usually, so a lot of times it happens in early adolescence, and sometimes it can happen a little bit earlier than that. But they have the same problems that an adult would have diabetes. Sometimes children, of course, will have complications that will be more severe as it pertains to the other organs of the body, but they can have the same problems as an adult person who has diabetes with the periodontal disease because their blood sugar is elevated, and it can cause them to have dry mouth, the same symptoms that you would have that if you were an adult diabetic patient. So there's really, as far as the mouth is concerned, you can still have the same types of problems whether you have early onset diabetes or diagnosed as an adult.
All right. Now, ladies and gentlemen, if you're out there, again, if you have questions, pick up your telephone and give Dr. Wade a call. I have been pretty lucky in my life. I've not had a lot of dental problems, even though I have not always exercised the best care.
Well,
I think it was just, God blessing me with something, hereditarily.
And some people are just genetically blessed. I mean, they don't go to the dentist. And haven't been to the dentist in 2 and 3 and 4 years. I've had patients come in and tell me that. But the thing is that they just have been genetically blessed to not develop any cavities. Some people just have great oral hygiene and they don't have too many problems. But the thing is that you really should see your dentist every 6 months. A lot of people are not as fortunate as others to be genetically blessed and not have any dental health problems, because if you're a cake or a pie eater or those sports drinks and those types of things, those things are high in sugar, high in calories also, and they tend to take a toll on your teeth after over a period of time. I've had a lot of young adolescents come in my office, even people in their early 20s, and they're very into their health and they drink a lot of sports drinks, but those sports drinks have a high sugar content in it, and they would say, well, I don't eat a lot of candy. And I start questioning them on what they're drinking or eating and something like that. And they all have one thing in common. They're all drinking a lot of those sports drinks. And those sports drinks have a high concentration of salt and sugar. So that's what's causing their problems with the enamel breaking down, because it's just kind of like if you think about if you have an ice cube and you pour salt on it, it's the same principle. It's going to start to break down the enamel. Okay.
Well, you have another call, and you're on with Dr. Karan Wade.
Hello.
Hi, Dr. Wade. I have a couple of questions for you.
Okay, go ahead.
I've gotten in my older years and had to have work on my teeth.
Mm-hmm.
So, you may be one of the doctors that I may use for some.
Okay, you're kind of fading in and out. Are you moving around?
My question is, with the brushing of the teeth, I know I have to, because I was told I had whatever, gingivitis or whatever. In the morning when you wake up,
mm-hmm.
after you have done it the night before, do you still have to floss?
Yes,
in the morning?
It's recommended that you brush and floss at the same time. The thing is that when you floss your teeth, you remove any food debris that might be caught in between your teeth. And if you haven't eaten anything, like you're saying, if you woke up the next morning, you floss that night, technically you don't have to, but it's still recommended that you floss those areas, even though you hadn't been eating in your sleep. So, but it's technically recommended that you brush and floss, 2 to 3
Go
times
ahead
a
and
day.
floss even before I eat, is what I'm asking.
Yes, ma'am. You need to brush them.
Okay.
Yes, ma'am. Mm-hmm.
Sure.
Because you want to remove the bacteria that accumulated on your teeth during the night. There's a plaque film that's built up on your teeth at night, so you want to remove that.
Okay, yes, that's important.
Yes, ma'am.
My next question is about the toothpaste. Now, I'm trying to use, more holistic type of toothpaste as opposed to some of the others.
Right.
I know she gave me the, what is that, the Pro something?
Like Pro Enamel or something like that type.
Well, the pros that they have out there, these toothpaste that they say is so good for your teeth. So, yeah, Pro Enamel. I'm using that right now, but, I'd rather use something more natural, something that doesn't have the fluoride and stuff in it. What do you say about that? And I'll hang up and listen to you.
And I appreciate you calling. As far as the toothpaste, most toothpaste are very, very good. Fluoride is a very good ingredient that is put into toothpaste because it helps strengthen the teeth, the enamel, and helps your teeth be more resistant to developing cavities. A lot of people are using a holistic toothpaste or things that don't have fluoride in it. But the thing is that you're not actually swallowing fluoride. So as long as you're not swallowing fluoride, it's not going to cause you any problems. In actuality, the water that we drink, there's fluoride actually put in the water that we actually drink, unless you live out in the, suburban areas and where or some rural areas where they don't have it. But fluoride is actually put in the water. So just the amount of fluoride that's in the toothpaste is not really going to cause you any harm. But some people still don't want to have any fluoride, and there are toothpastes that are out there that are natural, and they have less no fluoride at all, or less of the ingredients that come in regular toothpaste. So it's more of like an individual thing, an individual choice. As long as you're brushing really, really well. Actually, if you brush with just water, as long as you're brushing your teeth, and the action of brushing is actually what's removing the plaque and debris that's built up on your teeth, you're still going to have a good outcome as far as your oral health.
All right, another call. I think that's fellow. Oops, hit the wrong button. Okay, David?
Good afternoon. Excuse me, Michael Harris and Dr. Wade.
Hello.
Busby. How you doing today, ma'am?
Just fine.
Great. I wanted to let you know, as I said before, and everybody that's listening, this lady is the best dentist that I've had in all my life. Everything was comfortable. Everything was, just beautiful. The staff, they helped me. They did this, they did that. They were real polite. Hey, they're good. I'm happy right now. And I'm not in nobody's pain. I just left from up there. That's why I know.
Well, I appreciate you taking the time to call in, especially if you just had those teeth taken out.
Yes, ma'am. Yes,
I appreciate you calling in. I appreciate you letting the listening audience know that that I do try to go the extra mile with my patients, and I try to instill that in my staff also, to go the extra mile, because you can just kind of like, if you go anywhere you can go to any grocery store you want, but if you go to one that doesn't service you well, you tend not to want to ever go back there. And so we try to use that same premise as when people come into our office. We try to make them feel comfortable as possible, and just make them feel that as at home as they could possibly be, because that just goes a long way, because they could have gone anywhere, but they chose to come to our office. So I really appreciate you letting the listening audience know that we do go that extra mile for our patients.
And that is a fact, and that's exactly what they did to me. Honestly, while she was doing her work, I was laughing. I was laughing because I just enjoyed what she was doing compared to other dentists I've gone through, and I'm screaming and jumping up and down. But she just did a good job.
And I appreciate you calling. I really do. Thank you so
You're
much.
welcome.
All right.
Have a good day. Thank
okay,
you.
you too.
All right. 713-526-1230 is the number. Testimonials from Dr. Karan Wade. Now, you do everything, almost everything.
We do about almost everything in our office. Sometimes patients will come in with that, or maybe like patients who have impacted wisdom teeth. That means they're totally down into the bone. I don't do those. I actually refer those patients out. And I do just about almost all procedures. There's not too many procedures that I don't do. Sometimes I will refer some patients out who need root canals. If I don't actually see the canals on the x-ray or anything like that, I might refer those patients out. But as far as almost any dental procedure that there is, I practically do it. And if it's outside of my realm, I will refer you. I have no problem telling you that's outside of my field of expertise, and I'm going to refer you, and so you can get the best care.
Okay. Now let's talk about some of the things that you do.
Okay, well, we do your basic examination, your x-rays, your basic cleanings. We do your fillings. We use the white composite fillings. We don't use the silver fillings. We do crowns. We do bridges. We make partials, dentures. We also do implants. We do, like I said, almost anything that you might need to have done to your mouth, we do it at our office, and we do it to the best of our ability. Make sure that you are being taken care of very well. All
right, now you talked about doing implants, and you do extractions, you do root canals, and I guess according to the other caller, the first one who said he never feels any pain, so that means that you even do painless root canals.
Well, the people who have problems with root canals when they go to the dentist, first of all, they come in and their teeth are infected. So you have to remember, if your tooth is infected or your gum, the soft tissue around the tooth is infected, it's very difficult to get you numb. So sometimes you may feel pain. So that's why you hear a lot of people say, oh, don't get a root canal because it hurts. But it doesn't hurt if you get it done prior to the infection setting up in your soft tissue or in your gums, because once the tissue, there's infection in the gums, it changes the pH of the tissue. And so it's very difficult for the anesthesia to get to that nerve and block that out. So sometimes even patients come in and they're in pain, they need a root canal, but sometimes I can't even treat them. I have to give them some antibiotics to get the infection out of the gums and then have them come back, and then I can get them taken care of. Because we try to do it without, with a lot of infection in there. They're going to feel everything I do, every single thing. And we don't want that.
Yeah, and
I want to keep getting testimonials that I'm pain free.
Somebody put some metal stuff in my root canal, and I had to have it redone. What do
it
they
probably was a post. What it means is that if you had, sometimes when you have a root canal done in the tooth, usually there's an indication either the tooth is broke, you have an infection in there, and it has to be treated, right? Mm-hmm. A lot of times when they do root canals, they'll put, there's a filling type of material that goes down in there, but if some of the tooth portion is broke down, they'll put a post in there, and it's a metal post in order to give the tooth kind of like stability so they can put a crown on it. And sometimes those cause the tooth to fracture, sometimes they work and sometimes they don't. It just really depends on, circumstances of the treatment, without seeing what actually you had to have done. There's, the different situations as to why you might have had to have that post put in there. Sometimes the post will break. Sometimes even doing a root canal, just doing a regular root canal, you can break the files in the tooth. Not saying that anyone did anything right or wrong. There's just something that could happen when you're having a root canal done. Okay.
Well, I had to have it redone, and they had to call in a specialist. Now, do you have to call in a specialist, or you are a specialist in that yourself?
No, I am not a specialist in root canals. No, sir. I will refer you out to the specialist. So if I think that it's outside of my realm of me being able to take care of you, I'm going to refer you out.
Is there anyone better at doing those, not facades, what do they call them?
What, veneers?
Veneers, yeah.
Oh.
Well, anyone better than you?
Of course, I'm going to think I'm the greatest and, the best of the best of the best. I mean, I went to LVI out in Las Vegas to get my cosmetic training. So, of course, I'm going to think I'm the best. I mean, if you don't think that you're the best, then you can't expect anybody else to.
Well, I know that's right. So for those persons who need veneers.
They need crowns, they need root canals, they need implants or partials or dentures, or even just a cleaning. I want them to come see me. Our address is 2101 Crawford. We're located right on the corner of Crawford and Webster, Crawford and Gray, down in St. Joseph's Medical Plaza, about 2 blocks from St. Joseph's Hospital. And the office phone number is 713-654-7756. Again, that phone number is 713-654-7756. And again, I just wanted to tell all the listeners out there, I appreciate them calling in, and I appreciate their input and their comments and them giving me my little plugs there on the radio. I really, really appreciate that. And hopefully they'll continue to come see me, and I'll continue to call in.
All right. Well, we have one more caller before we have to go.
Okay.
And that is Mary.
Hello, Mary.
Yes, I would like to know your telephone number. I didn't quite get it.
Okay. That phone number is 713.
Wait just a minute.
You might want to turn your TV down a little bit.
Mm-hmm.
All right, I'm back.
Okay, it's 713.
713.
654.
654.
7756.
7756.
Yes, ma'am.
And your name is what?
Dr. Wade.
Dr. Wade?
Yes, ma'am.
Okay, thank you.
You're so very welcome.
All right, well, thank you. All right, Dr. Wade.
Well, I guess it's time for me to go, Mike.
Oh, it's time to say goodbye.
It's time to say goodbye.
To all the family.
But I'll be back in 2 weeks.
KARONWADE.
Oh, thank you so much, Mike, for serenading me. I appreciate that.
Dr. Karan Wade. Dr. Karan Wade.
Okay, Mike. Thank you. I don't know if that's good or bad for the listening audience, but I'll see you in a couple of weeks.
Oh, okay. Whatever.